Hi Jane.
Hi Mel.
Could you tell me a bit more about your role at Shropcom?
Yeah, so I'm a paediatric speech and language therapist. I work with young children across the trust who have eating, drinking and swallowing problems. I'm the clinical lead for that service for dysphagia, and I work with young children who've got communication difficulties or complex needs. And yourself?
Yeah, so I work, I'm a children's physiotherapist and I work in the community, mainly with children with respiratory conditions. So that includes children with things like cystic fibrosis or like yourself, complex conditions. I have a mixed caseload, so I do also do early years and special school children as well.
Oh, great, excellent. And have you always done that role? Have you always been in that?
No, I've only actually been in this role for probably about 3 years. I arrived during COVID, which was exciting. So previously I've done a rapid response role at children with at Birmingham Children's Hospital, and I mainly worked in hospitals up until that point. So all my experience was acute until I've just done a rapid response role and now this role.
Okay.
What about yourself?
Well, I've done lots of different things. So I started off by being a very generalist. I was lucky when I started, you could do both adults and children.
Yeah.
So I did that across the county of Devon.
Oh, wow.
So it's quite varied. Then I decided I wanted to go and do a master's degree to do a bit more studying. So I split my time between clinical and college, and I had to choose between adults and peds, so I went for the paediatric caseload, and then I sort of started to move on and become more specific in preschool special needs, and then I moved here and went into CAMS, so that's a completely different area, so Child and Adolescent Mental Health Service, and then I came into the dysphagia. So I'd been doing a lot of different things, really.
Did you know quite quickly you wanted to work with children?
Yes.
I'm just remembering from myself. So I did, as we do when we qualify, you do like a rotational system.
Right.
And I did adult rotations, and then my last rotation on that band 5 pathway was paediatrics, and it just lit me up. And I thought, right, this is what I want to do. So then I went on to do paediatrics from then on. So what route did you follow for your training? Did you do A-levels first?
Oh yeah, I did the standard. I did A-levels, and I went straight from A-levels to do a Bachelor of Science honours degree at University College London, and it was a 4-year degree course, so I did that. And then, as I said before, I came out, started working, and after about 2 years I decided actually I was missing the study. Mad really.
Wow.
But I know. But so I went back, I actually went back to UCL and did my master's while I was working. So that was my route. What about you?
So yeah, I did A-levels, but I was very lucky. I don't think they do it anymore. Again, we're going back a little while. They used to do it. It was called a pre-paramedic A-level course.
Okay.
So I did 3 A-levels, not 4, and then a day a week work experience. And that was within all of the sort of AHP roles.
Wow.
So that helped me decide, which I think is really hard for some newcomers, isn't it, to decide which career. Did they want to do physiotherapy, or did I indeed want to do occupational therapy or speech and language therapy? I actually did some time with the paramedics as well, and the nurses, radiotherapy as well. So I did that, and it built up a picture, just so I knew which profession that I'd prefer to do. So that was really helpful. And then I did my honours degree at Coventry University from there. So yeah, I think for people starting their roles now, I think it's quite important to get experience first of the actual role, to know exactly what the job is, because I think that's where there's massive gaps. I mean, if you think about a physiotherapist, if you ask somebody what a physiotherapist does, for example, they won't really know what we really do. No. They'll think of football and massage and things like that, which absolutely isn't the case, is it?
No, as speech and language therapists, people talk about elocution a lot to me, and they'll say, "Oh, you can help me with my speech." That's such a small amount of what we actually do. And as I said, I work with feeding problems, and most people have no idea that speech and language therapists work with that. It's funny you said that about having a look at which AHP. I actually thought I might be a physio when I started. Yeah, that was the first thing I was looking into, was physiotherapy. It's not that I wouldn't like to be a physio, I think it's a brilliant job, but speech and language therapy suited me better.
Yeah, everybody's got to find their way, haven't they? And they know what you've got to be really, you know, you've got to enjoy what you're actually going to study, because it's a long you know, career.
It's not easy.
Yeah, it's not easy.
No.
What do you like best about your role at Shropcom?
Oh, now that's a really difficult question. What do I like best? I love the multidisciplinary working that I do. I love the joint working that I do with my allied health professional colleagues.
Yes, me too.
With the doctors, with the health visitors. I love the helping the families to see the positives and to know how to manage. They've got a problem. How do they manage that? How do they make a difference? That joint working with the families is really important to me. So yeah, I think it's more about the joint working and learning from others as well. So I'm not only sharing my knowledge, but I'm gaining knowledge from other people all the time.
Yeah.
So
Yeah.
And you?
So yeah, I really like working in the community. It's very flexible, isn't it? And I really like being able to take my advice and expertise to home, because I'm used to working in a hospital, and the children used to be discharged to, you know, nothing. So that's why, one of the reasons why I went into the community, because I felt that was a gap. So I still do some acute work. I do clinics in hospitals still in this role, which is great. So I've got those links with them as well as the community colleagues. So yeah, it's I've got best of both worlds, but now I can actually leave the hospital and look after them afterwards. So I've done quite a lot of admission avoidance work as well, which is a bit like rapid response, but in a very low-key way. So if somebody's discharged from hospital, for example, they've been in with aspiration pneumonia, I can then help them at home, because it is a long recovery. The hospital is just the start.
Absolutely.
It's quite a long recovery. So once they get discharged home, I can be involved with that as well, and just to give them tools to actually, you know, hopefully avoid, like yourself, being admitted again with a similar problem.
Absolutely. Yeah. I get a chance with the neonatal work that we do to support the little ones and the families, and that seeing them in hospital, and it's so important, that home contact when they've come home, that following through, absolutely vital, really.
And a lot of those children have respiratory problems.
Yes, they do.
They also can have neurological problems as well, so I can help with all that. And starting from being very small and getting in there early is really important,
absolutely,
isn't it?
Vital. Yeah, absolutely. The earlier the better, really.
Absolutely.
Yeah.
What other roles and teams have you worked in before? We've talked a little bit about that, haven't we?
Oh, right, wow. So as I said, I've worked, my previous job before this one was in the Child and Adolescent Mental Health Service. So I did, again, multidisciplinary working with the assessment process for young people who with queries about whether they're on the autistic spectrum or do they have ADHD problems. So I worked with those young people and their families, and I also provided a service to young people with selective mutism in the community. And there wasn't a really good big service at the time, so I helped to develop that service and to bring awareness really to the trust and to local authorities, etc. That it's out there. There are lots more young people, but because they were so silent without the voice, it wasn't really.
I think that's a big part of our role, isn't it? Is actually developing services.
Absolutely.
So actually seeing the gaps and filling them with our expertise. So yeah, I've done a lot of hospital work and a lot of cystic fibrosis work, but I've also done rapid response and hospital avoidance. And I've done a lot of work with big hospitals, which involves a lot of on-call and crisis work. Okay. So with my rapid response role in Birmingham, I felt like a paramedic. I was walking around with a big rucksack and rescuing children who were about to go to A&E. So it was assessing the children, trying to get them sorted out. Worked with nurses mainly. So if somebody was about to go to A&E, they would ring rapid response first. I'm sure the adults have got a service here, I'm sure, and then we could try and keep them out of hospital, because a hospital admission is devastating to not just the child, it's the whole family is involved. Absolutely. And everything's turned upside down. And can be quite scary for them all. So if you can avoid that hospital admission and avoid the cost,
yes,
that pays for your job really. That hospital admission, then that's really good. So yeah, and I worked at Stoke Hospital as well, which is a huge hospital and required a lot of sleepless nights on call, doing lots of respiratory care in the middle of the night, which is really good experience. I think if you're going out into the community, it gives you a bit more confidence that if you can deal with that in a hospital, then you can deal with it and assess well in the community and know whether the child is that poorly that they need to go into hospital, or whether you could keep them at home. So that was good. Like that. I'm also doing my advanced clinical practice, and so I'm hoping that's going to help enhance my role as well. There's a course that there's an e-portfolio route that I'm going to follow, and I'm actually doing it from the Sheffield Hallam University, and they encourage you to collect all your evidence of what advanced clinical practice you're actually doing currently, and then you can put it on like an e-portfolio electronically, and if there's any gaps in your knowledge, then they'll encourage you to do courses to top that up. So that's really interesting. I'm actually an independent prescriber, so that's already probably half of it of what I need to do, because that's obviously an advanced role. And what that helps me do in the community is rescue children who need antibiotics, for example, or certain nebulized antibiotics or mucolytics, or the drugs that the doctors usually prescribe. It stops that needing to go to the GP or hospital, and they've got a much clearer pathway, and I can help them stay at home, which is what the community service is all about, isn't it?
Absolutely.
But yeah, the course is 6 months, and you need to do your portfolio, which is a bit like the old-fashioned, you know, we used to do paper portfolios. I'm involved in a national group of prescribers for cystic fibrosis, and when we first started, there was 5 of us that started this course. There's now 43.
Fantastic.
Yeah. So it just shows you how roles are developing across the country, doesn't it?
Yeah.
So yeah, that's really exciting.
Yeah, excellent. So I've been quite interested in looking into research more myself recently, to sort of back up some of the work that we're doing, but also thinking about where the gaps are and what we don't know. And
I'm doing a lot of what we don't know at the moment. I'm involved in 2 Delphi studies, which is basically you've got your what you think's happening, your clinical questions, and you can ask, like on a questionnaire around the country, what do you do? And you'll get a lovely, this is what's being done around the country, and then you look at the evidence, what you should be doing, and it can answer your question for you. There's some really good work going on. That's in cystic fibrosis. So we're asking the question of should we give DNase, which is a drug that helps loosen the mucus? Should you give it half an hour or an hour before physiotherapy? Or can you give it at any other times? And we're looking at the evidence, and we're going to scope around the country to see what everybody else is doing. We're doing similar stuff with hemoptysis and pneumothorax as well. So yeah, it'll be really useful when we know those results. And it's really useful when there's other people around the country doing it as well. So you get massive numbers, so you can get a good picture of what's happening at the moment. Because if you don't know the answer to a question, it's really difficult to move forward, isn't it?
Absolutely.
Evidence-based practice and everything, you know, you need to...
It's essential.
Absolutely essential.
Yeah, absolutely. Okay. And students, do you have not a lot of contact with students? Do you support students in your role? So the physiotherapy service does have students. We have students at every cohort, really. And I think the students enjoy coming into paediatrics. I think it's fun working with children, isn't it? I think so, yeah.
Much less stressful. Some people may think.
I don't know.
I know.
It has its challenges.
That's my comfort zone is children, whereas for a lot of people, their comfort zone is adults. I'd much rather talk to a child than I would talk to an adult, which is just me. When What about yourself? Do you have students?
Yes, we all have students as part of our Royal College, sort of our HCPC, our professional body, the same as yourselves. So it's something that we are signed up to doing, to bringing on the next generation of speech and language therapists. And we have cohort every year. We have different year groups from masters and bachelor's courses. And they tend to be split between the team again. I think it's very similar, that we try and give them as much of a breadth of a taste of what it is to be a speech and language therapist, because even when you're training, I think it's quite difficult to know what it actually is to be a speech and language therapist. And we try and give them placements. So I often have my students in the special school that I work in, but I do have them in the community as well. And so any area that you find a speech and language therapist working in, they could end up working with them. So we do try and get the students involved in face-to-face assessment and therapy with the children, but we also get them to do all the other stuff.
Yeah, us too.
All the other bits. Yeah. So and make sure they have a taste of what the admin is, how our electronic notes work, how the liaising with other people is a big part of what we do. Is a very small part is the face-to-face, I think. It's probably, I would say, about a quarter.
Like a supervised assessment, there's nothing like it, because you can talk through it afterwards and things they've missed, and it's all about developing their skills, which is essential. A lot of people don't think of paediatrics when they're students. I think they think of the main adult roles and go through those sort of placements, but I think paediatrics has definitely got a more varied approach, because we cover everything, don't we? In comparison to going on a respiratory placement in a hospital where you'll be doing medical patients or intensive care, and that's it for the whole placement. So at least they're doing a varied amount of work, and I think they really enjoy going in the special schools as well.
Oh yes.
And seeing what school life is like for these complex children. So yeah, I take them into the hospitals as well, and we do cystic fibrosis clinics, meet the consultants in a hospital, so they've still got that link. But yeah, I think they quite enjoy. I think we've got good student placements, haven't we?
Very. I think we're quite supported by the universities as well, so that's quite a nice.
I think we have 4 of our physios that are qualified in the course that takes students, so we can have a number of students at any one time. Do you have a few at a time, or do you just have one?
I quite often have 2 at a time, purely because I find that easier, because then the students have got somebody that they can discuss. While I need to go off and if I need to go and do something else, they've still got that opportunity to work with a client, with a child, backing each other up, if you like. So I think it's a little bit, it's easy. I find it easier to allow them a bit more autonomy when there's 2 than when there's 1. So it's quite nice for them.
Talk things through at their level.
Absolutely.
And support each other.
Yes, peer support's very important. Always. Okay, are we on to the last question with what's your best piece of advice to others seeking a career in your profession?
I personally would say that getting some experience of the career that you want to pursue. So I was very lucky that I had a day release to do that. I know that doesn't happen in current colleges. So I think if you do want to do an AHP career like physiotherapy or speech and language therapy, is go and ask and do some work experience and find out exactly what the role is, because it actually might change your mind.
Yes.
Might it?
It might do.
You need to know exactly what the role involves. I think it'll sort out the people who really want to do the career and the ones who think they want to do the career. So yeah, I'd advise them to seek some advice. Speak to somebody who's already in that profession. Well,
yeah, that's definitely what I would say. And also, I don't know about you, but we have a professional body, Royal College of Speech and Language Therapists. I know you have your own. And on our website, there's quite a lot on there on the career and what it might be and what it might entail. So I think doing a little bit of research as well. But having that sense of what it is. The other thing that I would always say is, if you're interested in working with children, if you haven't had a lot of experience of being with a child or children, go out and do some volunteering in a school or in a nursery or a youth club or something. So you have that sense of typically developing youngsters and how they communicate and how they interact. They do what I did, straight out of A-levels, straight into university. I was the youngest in my family, so no children.
No children, no cousins.
No cousins, nothing. I was the little one. So it's having that sense of what would you expect when you communicate with a 3-year-old? What would they be doing?
And simple skills like picking up an infant.
Yes, actually, what do they feel like?
Yeah, and where do you support them? That, when you're a parent, you pick up that child for the first time, you're a bit, you don't want to do that in front of a parent. You need to have that skill, don't you? So that, there's a lot of experience required really with children. But from a career point of view, I think finding out more about the career that you're choosing to do, rather than just going through the university programmes. We have a Chartered Society of Physiotherapy professional body that's got a website with all that information on as well. But I definitely encourage them to speak to a physiotherapist, occupational therapist, speech and language therapist, if that's what you think you want to do. Because I think the roles are very similar, but actually also very different. Yeah,
there's a lot of overlap, but there are a lot of dissimilarities.
Yeah, and the courses are completely different, aren't they? So you need to know.
With the research side of things, one of the questions that was sort of posed. The idea is, how do you get into research, and how do you what do you do to follow that through? Well, obviously, I did quite a bit when I did my masters, so I have an understanding of research to another level from the bachelor's sort of level, but I've forgotten a lot of it because that was a long time ago. So I've actually thought that I would like to get into some more research recently as part of my role with feeding, because I think there are quite a few gaps in our knowledge base for our evidence-based practice. And how else are we going to find it out than doing the research? And I think it's really important that clinicians start to do more research, and I think it's becoming more encouraged as well. Certainly our trust is encouraging, which is great. So I've recently applied for a post to look into that a little bit more, but they have lots of courses going on out there which I didn't know about before I started looking into it. So there's things like Birmingham University are running a programme, and it's a time funded programme, and there's lots and lots of these things happening out there. And I think if you're interested in following into research and doing more, advancing your role and becoming more of an advanced practitioner, it's like you said, you're on a course, you're learning about it. There's lots of support out there, and I think there's toolkits that are available to people. So it's about looking and finding those out, contacting the universities, isn't it?
Yeah, definitely. I think the courses are out there. It's just knowing where to look, isn't it? And certainly for research, because we have to now go on evidence-based practice. I think it's essential if there's gaps in services, and where are we going to find these questions out? If nobody's doing research, we're never going to move forwards. No. So research is essential. Groups, we have subgroups similar to the CEN that have specialist groups that discuss certain things, and they're really good for starting off research, because they'll all have very similar research questions to yourself, so it's really good to network and realise if you all work together, it makes it a lot easier. And if you have somebody that's already doing research or has links with a university, that's even better, because it's the links with the university, especially if you're doing things like statistics, or even just a consenting process, and things like that is really hard. So some links to a university, and put your clinical question out there. Use the internet. Use the
library services.
Yeah, library services as well. Use the we have an ICSP network on our website, where it's interactive network. Ask your clinical questions. See if somebody else is doing the research. Don't reinvent the wheel. Make sure you know that question's relevant and it needs looking into, because a lot of people spend a lot of time doing very similar studies, whereas actually if you choose to do a different one, you could get more answers. But for research.
I've been very fortunate actually. So when I first moved to the area, as I said, I wasn't working in this trust. I was working with another trust, but I still had links in with this trust because well, for various reasons. And I did a little bit of dysphagia work all the way through. And the team have been incredibly supportive, to, offering me supervision, advice on my career and how where to go for extra information, where to go to develop my knowledge. And when I was voicing the fact that the selective mutism caseload in this area didn't have a great, people didn't have a great awareness about what selective mutism was. There was nobody advocating for them, if you like. That was really encouraged, to the point that I was put forward to stand. We have the awards every year.
Oh yes.
Shopcom, and I had a little stall at the front. I got
Fantastic.
to see all the heads of the exec committee, and all of these people came over and they talked to me about it and they asked me questions. So I really felt like I could get that voice out, that knowledge out. So that was, and I was supported by my line manager for that, or rather the line manager from speech therapy for that, and being supported to move that forward. That's been really, really important to me, to know that when I have an idea, that I'm helped to think it through, but then I'm supported to carry it.
You can run with it.
I can run with it.
Yeah.
Good. If it works for the service. So what about yourself?
We have the appraisals process every year,
Yeah.
and on there we can put what we aspire to do for that
Yes.
year, and that can sort of develop into doing whatever, and they'll support you through that. If there's a certain course you want to do, and you discuss it with your line manager and you pop it on that appraisal, hopefully it'll be funded and you can do them. They're very supportive and things like that. So my advanced clinical practice, because I already prescribe, I thought that would be a good step forwards, is actually proving my worth, and yes. I am an advanced clinician, so that's why we thought the AHP course would be a really good idea. And they're letting me do some of that in my time, some of that in work time, so they're supporting me through that. So very supportive.
I can't believe the amount of sort of training that's been made available, and to be able to do the best job that I can do. It's been
and being up to date with what you do.
Absolutely important.
I think it's important to move with the times and to make sure that you're on top of your game.
No, I've been very lucky, and certainly feel very grateful for the support and the supervision that's been provided.
I don't think that's just at our level either.
I think it's across
everybody, no matter what your band, you're supported to do what you want to do course-wise. It's important, and obviously you've got all those services around you, all your multidisciplinary colleagues, you've got your library, you've got all those things to support you as well.
And I think if you share with your line manager what you're interested in, what your passion is, because I think you don't do this job without getting passionate about it. That you are enabled to move, if that's possible for the service, to be given those opportunities to follow that
to support you in future jobs. If they know what you're really interested in, certainly at a band 6 level, they can help you get to that next level and the next job and support you through that as well.
Very much.
Which is of course essential for your career development, isn't it?
And satisfaction.